Welcome to The Explainer, everyone. Today, we're going on a bit of a medical detective journey. We're breaking down a really fascinating and, frankly, critical case study. A 14-year-old girl presenting with restricting type anorexia nervosa. You know, societal stereotypes often completely cloud our understanding of what this actually looks like when a real patient walks into a clinic. So we're going to step right into the shoes of the evaluating clinician. We'll look strictly at the data, the behaviors, and the physical manifestations to see exactly how this illness takes hold of the human body. Let's get into it.
Okay, let's dive into this. Here's our clinical roadmap for today. First up, we'll look at the presenting patient profile. Then, we'll uncover some crucial behavioral clues. Third, we're looking at the actual physical toll of starvation. And finally, we'll expose the hidden metabolic and cardiac risks.
All right, part 1, the presenting patient profile.
So our patient is a 14-year-old girl, currently in the 9th grade. She's brought into the clinic by her mom. Now, what's absolutely crucial to note here is the chief complaint. The main reason they're sitting in the doctor's office isn't flagged as an eating disorder right out of the gate. Actually, the chief complaint is fatigue, alongside progressive weight loss, and the timeline here is a massive clue for us. This weight loss has been happening over an 8-month period, so we're not looking at a sudden illness. It's a steady 8-month decline that has finally resulted in exhaustion severe enough to bring them in.
And this brilliantly illustrates just how severe things have gotten. Historically, this young girl was right up there in the 75th percentile for both weight and height, growing exactly as you'd expect. But currently, she has plummeted all the way down to the 10th percentile for weight, and her height growth has stalled out at the 25th percentile. This drastic drop tells us immediately, literally at a glance, that her body is simply not getting the fuel it needs to maintain basic development. The clinical danger here is just incredibly apparent.
To put a really fine point on her physical state, let's look at her BMI. It currently sits at a stark 15. I want to present this number to you completely in isolation because it really underscores the acute state of starvation she is in right now. Before we even begin to unpack the psychological stuff or the behavioral elements at play, this single metric screams that her physical system is in severe distress.
Which brings us to part 2, uncovering behavioral clues. When taking her history, the patient offers a very specific explanation for all this weight loss. She says she's simply, quote, trying to eat healthy and cut junk. Now, this is a profound moment in the clinical evaluation. On the surface, sounds great. It sounds like a positive, universally praised goal. But as we're about to see, this stated intent of health is basically acting as a mask. We have to juxtapose this seemingly innocent quote with the stark clinical reality of her daily life. Because the reality, according to her mom, completely contradicts that whole just eating healthy claim. Let's look at the actual behaviors. She skips breakfast entirely. For lunch, she eats just a tiny portion of vegetables. Come dinner time, she flat out refuses the family meal, claiming she already ate. So her intake is severely restricted. But that's only half the equation, right? On the output side, she's recently started running for 60 to 90 minutes every single day, plus doing these online fitness challenges. And the psychological strain is just so visible. She weighs herself multiple times a day, gets super anxious if the scale moves even a fraction of a pound, and spends long chunks of time just checking her body in the mirror. It's extreme restriction paired with extreme energy output. And all of these behaviors are driven by one intense psychological trigger. The patient repeatedly expresses this fear of, quote, getting fat like some of my classmates. This isn't just some passing worry. It is an intense, overwhelming fear that dictates her entire day. It drives the scale anxiety, the mirror checking, the running. This fear of weight gain is the engine powering all those dangerous behaviors we just talked about. Now, as you probably know, anorexia nervosa can present in a few different ways. To confirm this specific diagnosis of the restricting type, we have to explicitly rule out other behaviors. Step 1, no history of binge eating. Step 2, no self-induced vomiting. And step 3, absolutely no laxative or diuretic use. She also denies any alcohol or substance use. Because her weight loss is achieved entirely through dieting, fasting, and excessive exercise without any purging behaviors, the diagnosis points directly and definitively to the restricting type.
Moving right along to part 3, the physical toll of starvation.
As the doctor conducts the physical exam, several external signs of a hypometabolic state become immediately obvious. She visually appears undernourished, with her bones prominently showing. Her skin is notably dry. Interestingly, there's no edema, so no fluid retention or swelling, but she does complain of feeling cold, even when it's warm outside.
And, this feeling of constant cold is a direct result of her body literally lacking the fat and energy required to generate basic body heat.
Now, what's really interesting about this next finding is how the body adapts. On her arms, the doctor finds lanugo, that's a fine, downy hair. Why does this happen? Well, because she's lost so much body fat and can't regulate her own temperature, her body goes into full-on primitive survival mode. It literally attempts to insulate itself from the cold by growing this fine layer of hair. It's a remarkable, yet completely alarming, physical adaptation to severe starvation.
Another massive red flag here relates to her reproductive health. The chart notes that she had her first period, menarche, at 12.5 years old. However, she has now developed secondary amenorrhea, meaning she hasn't had a period for the last 6 months. This happens because the body is in such a severe energy deficit that it just starts shutting down non-essential systems, all to conserve fuel for the brain and the heart. In a starvation state, reproduction is deemed non-essential, so the system simply powers down.
Okay, on to our final section, hidden metabolic and cardiac risks.
When a human body is literally running on empty, the vital signs reflect a desperate attempt to save itself. Her pulses drop to just 48 beats per minute, and her blood pressure is remarkably low, sitting at 86/54. What you're witnessing here is a systemic hypometabolic slowdown. Everything inside her body is putting on the brakes, trying to expend as little energy as possible just to keep her alive.
To investigate that extremely low pulse, they run an ECG, which confirms a diagnosis of sinus bradycardia. That is a dangerously slow heart rhythm. Her heart muscle, much like the rest of her body, is being deprived of adequate nutrition. A heart rate dropping to 48 beats per minute, that highlights a severe, acute cardiac danger that requires immediate and very careful medical management.
Finally, her basic lab tests come back, and they further indicate systemic metabolic distress. We see mild hypoglycemia, meaning her blood sugar is low, which, let's be honest, is hardly surprising given she barely eats. We also see borderline low potassium levels. When you pair these lab results with the sinus bradycardia and that low blood pressure, it paints a very clear picture of a human body struggling to maintain its most basic, life-sustaining chemical balances.
And this brings us to a critical reflection based on everything we've uncovered today. Our patient genuinely claimed she was just trying to eat healthy and cut junk, which is a phrase we hear constantly in modern fitness culture, right? Yet, underneath that seemingly harmless claim was an 8-month descent into starvation, severe anxiety, and acute cardiac risk. It leaves us with a pretty powerful question. When exactly does the societal pursuit of health and fitness cross the line and become a dangerous clinical pathology? It's an incredibly thin line, and as this explainer shows, understanding the actual clinical data is sometimes the only way to see when it's been crossed. Thank you so much for joining me on this deep dive. Keep questioning, keep learning, and I'll catch you in the next explainer.